when you go through such a thorough education, you will have these instincts that come out of nowhere once you're in the practice, and it's so important to trust them. I went through a lot of different career paths when I was in high school, trying to figure out what I would want to do. It was a few of my friends that actually suggested that I should go into something where you're working with other people, and I hadn't really thought of it before, but I started looking into it, and I realized that it was something that I would really enjoy and that would probably fit my personality really well. Once I started working at the hospital, and really once I started having clinical rotations in my college career, I started realizing that I loved working with other people, with patients, communicating with patients, hearing about how their day is going, and kind of making a difference in communicating with them to have a positive impact on their day. In general, that was always my goal, just to make someone's day better. I don't have the crazy aspirations, but I just wanted to have an impact on their day and their experience that I was going through with them. So I decided to continue my education at Fairfield University following my graduation from the undergrad program, and I started taking classes towards my doctorate of nursing practice for the family nurse practitioner program. Just to continue my learning and also to forward my career after. I'm enjoying everything in the emergency department. I love being a registered nurse, but I'm excited to continue learning and move into more of a practitioner role. I've completed 1 year, so I have about 3 years left now.
With a long history of preparing students for careers in the expanding fields of medicine and health studies, Fairfield University's Marion Peckham Egan School of Nursing and Health Studies is quickly adapting its online learning and classroom settings to provide a practical and engaging education for students.
So they use these rooms to teach skills to the students. This room specifically is used for the anesthesia nurse practitioner students, but they have all the same equipment that they do in the hospital. They actually have cameras, and they'll videotape you doing your assessments and your different skills, and then they will go through and give you feedback on it. So it's completely stress-free. But you learn so much from it because it still kind of puts you on the spot. So it stimulates growth, but you can't do any damage. So that's always nice to know. Luckily, a lot of what I do in the emergency department is focused assessments. So we go through, and if someone's having ear pain, we'll do the whole head and go through all those questions. So a lot of it I've learned in practice and can kind of now apply to moving forward with my education as well.
My job here is to teach undergraduate and graduate students in the profession of nursing. They have to be comfortable with people and taking care of people. That has to be, I think, a passion that's instilled in all of us, is caring for other people. But I also think you have to look at the world around us. Nursing offers many opportunities. You can start with your bachelor's degree in nursing, which is a typical 4-year undergraduate nursing degree. So like students go to college for 4 years. You can come out with your bachelor's and work in the hospital as an RN. Our second program, which also offers nursing opportunities, is for students who went to college and perhaps didn't really know what they wanted to do, and after graduation decide that they'd like to pursue a field of nursing. We have what's called a second degree nursing program. So they come back and they do a 15-month accelerated program. We also offer multiple master's level programs. And then more recently, we've developed a doctorate program, which provides extra education in the field of research. We also have sideline programs. We have a nurse midwifery program. We also have a nurse anesthesia program. And most recently, we are developing a nutrition program. Nursing has always been a very valued profession, but I think now more so because so many people are without jobs right now. Our nurses have not been without a job, and they're looking for more. So that's another reason I always get excited for the undergrads who come in. I think it's difficult to be an 18-year-old student and recognize what you want to do for the rest of your life. But if you can choose nursing as a career path, there's so many different venues to go to. And now more than ever, you see that as a valued profession where we really need you. If people aren't able to get jobs in other professions, there's plenty of jobs to be had in the field of nursing. And I get excited because you don't just have to go into the hospital. You could be someone who's interested in public health or bedside at the doctor's level and have many opportunities to take care of people on many different levels. We had to get very creative. Nursing is very hands-on, so it was very difficult in the beginning just because we had to figure out a way to provide meaningful education without that hands-on experience. Much of the education that nursing students get is in the hospital or clinical setting, and that was stripped away rather quickly related to the pandemic. So we were able to virtually use our simulation lab as well as experiences that we had built prior to go online and educate the students through a video technology that we had used prior in coordination with case studies to provide them with the best possible experience.
I started working as a new grad in the emergency department in October of 2019. And then the pandemic really started for us about in February of 2020. So I had been off orientation for 1 month and was working by myself. So it was interesting in the fact that it was new for everyone. So even the seasoned nurses that have been there for 30 years have never seen something quite like COVID. So we were all kind of on the same page, and I noticed that there was such a great sense of team in our emergency department, of everyone helping each other, making sure, checking on other people, other nurses, making sure everyone was doing okay on a physical and emotional level, that I think it brought us together as a team even more than we already were. To see the community really come around the healthcare workers and support them, because it was very scary, and we still don't know what's going to happen, but there's much more of a sense of team and community within the emergency department, the hospital, and just our general community in Connecticut as well. The one thing that I always tell new graduates that are graduating and going into the nursing field is to definitely be sure of yourself, because nursing school, you learn so much information and you'll learn so quickly that all of it actually applies to practice. When you go through such a thorough education, you will have these instincts that come out of nowhere once you're in the practice, and it's so important to trust them, because a lot of the time you're right and you could really make a huge difference in people's lives.
This production is part of American Graduate, Getting to Work, a public media initiative made possible by the Corporation for Public Broadcasting.